to another titillating episode, Scissors and Scrubs. I'm Nicole.
I'm Laura.
Easter's around the corner. I can see my little tulips coming out of the ground, the daffodils. It's going to be 60 this weekend.
It is?
Yes, it's supposed to be 60 tomorrow.
Oh, nice.
But I think it might snow at the end of the week. Who knows? I mean, it's spring in New England. Anything's game. So we thought we'd kind of cover Easter. Like, all right, we're not really pulling a religious thing, but these are all related to Catholicism. It is. So you're going to cover...
I'm going to cover Katad delusion.
Yeah.
I know I'm going to say that wrong, and I'm going to say it 18 different ways, so God bless. And Jerusalem syndrome.
Ooh, I can't wait for these.
I've never heard of either of these things.
I'm going to go over the fun things that Romans like to do to people they didn't like, ending with the crucifixion.
Very creative.
Yeah, how they did that. I mean, right now it's 10 o'clock in the morning because Mike's on this fucked up schedule that we're recording at 10 a.m. instead of evening.
Nice.
Not on my game. The Bloody Marys aren't enough to get me going at 10 o'clock in the morning. So power through until Mike's back to his regular scheduled programming, and we're recording at night when it's a lot more fun.
I have a Bloody Mary, a water, and a coffee.
That's a mix-up.
It's too early.
The coffee and the Bloody Mary, I think they're just going to cancel each other out. I don't know if it's... You might want to lay off the coffee for a few minutes.
I guess.
You know, I mean, I love a good Bloody Mary.
This is delicious.
Some bacon, fucking olives and shit.
The
in there.
blue cheese.
Oh, we need to go away where we're just like, I want to go with, there's a place in Maine that has 21 types of Bloody Marys.
No.
I would like to sit and go through all 21, but 3 and I'd be throwing up in my eggs. But
that's a lot of tomato juice.
That's true. A lot of acid, a lot of reflux.
Yeah.
But I wouldn't mind sitting down, just having couple of good.
There's a place around here that has a brunch.
Why are we not doing that?
Regular times, not COVID times, and it's they have like a Bloody Mary bar.
And why are we not doing that?
Oh, I think it's COVID, but
I want one of those Bloody Marys that has like a slider on it.
Yeah, the whole hamburger.
Like my eggs come in the Bloody Mary. Okay.
Okay.
All right. So you want to kick it off with Katads?
Yes. Let's go with Katad.
We had to literally Google how to say this word because it's spelled
still
so.
Not saying it right.
We're just going to go with Katad.
Katad. Cotard. So whatever you want to call that. Katad delusion. I got this information from healthline.com by an article written by Nancy Moyer. Katad delusion is a very rare condition where a person believes that they or certain body parts.
I can't wait for where you're going.
are dead, dying, or don't exist.
So they just wake up and my arm's dead, and it's my arm. I'm looking at it, but it's not there.
Yes. Or I'm dead. I know I'm here talking to you, but I'm actually dead.
Wow.
Yeah.
Wow.
Symptoms of this. Nihilism is the main symptom, which
what the hell is
that is the belief that nothing has any meaning or value, or that nothing really exists. So you just believe like it doesn't matter if I walk in front of a bus because this isn't reality. Like kind of nothing really matters. Another symptom is that you feel like you're dead or rotting away.
I feel like that.
I'm
aging
like my
every day.
Rotting right away.
As I put my makeup on and I have to look down into the mirror, I'm like, what the fuck? I need a facelift.
Yeah. So you feel like you're dead or rotting, and they feel like they never actually existed. Like somehow this is all like, I don't know, someone's dream or it's made up or they've never
existed. Is this like
existed.
a sudden onset type of thing, or is this like they always have felt this way?
No, it's a sudden onset.
No, like you wake up one day and you're like, oh, I've been dead for years. I'm wearing a sheet with 2 eyes cut out and that's it.
Yes. Some people feel like the entire body is dead or dying. And some people feel like specific limbs or organs or their soul is dead or dying.
Or their soul.
Which I
My
just
soul
said.
has been crushed.
I don't actually have this. They can have anxiety, hallucinations, hypochondria, guilt, preoccupation with hurting themselves, or death. You know.
This is weird.
It is. It's a very...
This is really weird.
So when Jack was little, and I cannot remember if it was his arm or his leg, but it used to make me so nervous because he would say it all the time. Do you remember this, Mike? He'd be like, my arm isn't right. Like, I shouldn't have this arm. Like, he had this thing. I don't know if it was like a nerve, something was bothering him in it, and he would say it all the time. They're like, I don't want this arm. Like, I don't want this. And I'd be like, oh my God, I know there's some disease that you think that's part of you. And I'm like, oh my God. I mean, he outgrew it. I think he probably had like a pinched nerve or something.
Like pins and needles or something.
But he would say it all the time. I don't want this arm. This arm shouldn't be on me. And I'm like, oh God.
Can I get a new one?
Yeah. I'm like, don't cut that off, please. So causes and risk factors that they don't know what causes this. They have no idea what causes this disease. Studies have shown the average age of patients is 50.
Oh, I'm close.
Although it can be seen in kids and teenagers. Women are more likely to develop it. People under 25 that have it usually have like bipolar depression as well.
So this is more like a psych issue.
It's a psych issue. Other things that cause it: bipolar, postpartum depression, catatonia, dispersonalization disorder, dissociative disorder, psychotic depression, and schizophrenia. So it's all, it makes sense that with these...
It's in the gambit.
Yeah. It's also associated with brain infections, brain tumors, dementia, epilepsy, migraines, watch out, MS, Parkinson's, stroke, or TBI. So anything that's going to affect your brain can then cause this to come up. Did you ever read
that book, Brain on Fire?
No.
About this girl who was, it's been a while since I read the book, so don't quote me on it. She was she wrote for a magazine. Mm-hmm. And she started she'd look at the pictures and the pictures would go funny, and she started having delusions, and she started seeing colors weird ways, and she started acting bizarrely and all this stuff. And they kept putting her in psych facilities. And then eventually they found out she had this massive brain infection. And it took years to clear up the infection. And they said a lot of people they think are misdiagnosed that have this infection. It was a really, she has pictures of her in the hospital. She's like, I don't remember months of my life of things that had happened. And her mother being there, her father would show up and she wouldn't know who he was, and she'd yell at him and she'd throw things at him, and everybody was like, what is going on? She's back to normal now.
Oh, thank God.
But it was a huge brain infection.
Yeah.
It was, and this one random doctor figured it out. Yeah. It's always one random doctor.
I know. We had a patient one time, and we were doing a craning for an infection. We were doing a brain surgery for an infection in their brain. I have never in my life, when we peeled back the bone flap,
oh, gross. I can
the smell of that infection. Your brain shouldn't smell.
No.
Your brain shouldn't smell like anything. It doesn't smell like anything.
And nothing should ooze out of it when you open it up.
The smell that came out when we lifted that bone flap, I thought I was going to die.
How did they get it? Do you know?
I don't remember. Honest to God, I don't remember. And I was like, it was back when we were in the other building.
That's disgusting.
I was like, I think I might have been a surgical tech then. It was the smell. This woman's brain.
Stunk.
It was disgusting.
That's disgusting. That's
so
disgusting.
Be careful with I think it might have been a sinus infection. I'm not 100%.
Oh, those can be nasty.
But I do have I do remember being like, this is what happens when you let your sinus infection
when you
go.
don't blow your nose right.
Yeah. So blow your nose. Diagnosis for Cotard syndrome. It's really diagnosed by ruling out other diseases. So, but usually it occurs alongside with other mental illnesses. So you might be diagnosed with two things. So you could have bipolar depression and Cotard. So don't be surprised if you get more than one diagnosis. Treatment for this is, because it usually appears with other mental illnesses, they will treat
the other illnesses.
Yeah, antidepressants, antipsychotics, mood stabilizers, psychotherapy, behavioral therapy, and they can use ECT, which is electroconvulsive therapy. That is the most commonly used treatment.
They say that is a really successful treatment for people.
So people, they zap your brain.
Yeah, right? It's not like, One Flew Over the Cuckoo's Nest, where they stick the rubber thing in your mouth and they, shock the shit out of you. They put you to sleep and
anesthesia. It
resets the brain.
Right. It's used a lot with severe depression.
Mm-hmm.
Like severe depression. Nothing helps you. You can't get out of it.
You want to kill yourself.
Yeah. So they use small electric currents that pass through your brain to create small seizures while you're under general anesthesia. So you are asleep. You are not
you don't know what's going on
awake while any of this is happening. But they cause these little seizures in your brains, which normally you don't want, little seizures. But it resets. It reprograms your brain somehow. And they do come out a lot of times feeling better.
Yeah. When I went, I did my psych rotation, and one of the patients she was inpatient because she wanted to kill herself. Like she said, all she could think about every day, all day long, was killing herself. She said, but after this, because I asked him, do you think it helps? She's like, absolutely. I don't think like that anymore. And she was discharged shortly after.
Oh, good.
But I was talking recently to a nurse who had been a psych nurse, and she said, sometimes you have to be careful, because when they're that depressed, they can't formulate a plan on how to kill themselves. And now after the ECT, they are clearer thinking. And she said that's a lot of times when they'll finish it.
Yeah.
So I was like, wow, I never thought of that.
Right.
She's like, yeah, it can be bad.
Yeah, but they do say it helps.
Yeah.
And they only do it in severe cases.
Right.
So they do ECT with Cotard syndrome. Risks of ECT are memory loss, confusion,
slurred
nausea,
speech,
and muscle aches. Yeah. So complications of Cotard syndrome are if you feel like you are dead or never existed, complications can arise. You stop bathing. You stop taking care of yourself because you think you're dead. So why are you bathing?
Why am I doing any of this?
Yourself? Which leads to more isolation because people don't want to be near you because you smell and you're not put
your brain
together.
smells.
Which leads to worsening depression. It also leads to skin and teeth problems.
Ooh.
And guess what that makes you feel like?
Like you're dead.
Like you're rotting.
Yeah.
So then they're like, see, I'm rotting. And because they're perpetuating it with the not taking care of yourself because you're dead. And then now your body's rotting because you're not taking care of it.
Well, speaking of rotting, this morning, of course, I Facebook every morning like it's the morning newspaper.
Right.
You know, believe everything you read. But some guy, you know how they do those pictures of the meth heads and what they look like before they first... This woman, not only... I can't even describe. She was the worst I've ever seen of these meth head progressions. No teeth. She was almost bald by the end. She must have been, I'm going to say, like early 30s. She looked like she was 80. All her teeth were gone. She was all sunken in, skinny. Her hair was a mess. Like, unrecognizable. My husband was like, that's not the same person. I'm like, that's the same person. He's like, that's no way the same.
It's unreal.
It was unreal. Talk about rotting out. I'm sorry. So go ahead. Digression.
They stop eating and drinking because they're dead. So they don't need to. And then that can lead to malnutrition, starvation, which then makes you look like you're skinny
rotting away.
And rotting away. Also, suicide attempts are complications. They're trying to prove that they're dead.
By killing themselves.
Yeah. So, because they can't die again.
Right.
So they're like, watch, I'm dead. I'm going to go stand in front of that car. It's not going to do anything because I'm already dead. So they don't. It's not really like I'm trying to kill myself. It's more
I'm proving I'm dead.
Proving to you I'm dead. It doesn't matter. Right. Or some of them do commit suicide or try to commit suicide to stop feeling trapped because they feel like I'm dead. I'm here. I'm not doing anything. I have no existence. Like maybe this will end it. So these people are living with a serious mental disorder. Meds and therapy and ECT can help them. You can get out of this. It's you're not going to feel like you're dead for the rest of your life. You need to get help because you can't get yourself out of this.
That's bizarre. That's the most bizarre thing I've ever heard. Like, what a weird manifestation of a mental illness. It's like, yeah, no, I'm dead, really. You know, don't look at me, I'm dead.
I forgot I had little stories.
I love stories.
Yeah. So these are like 10 records of people with Cotard's delusion. In 1788, Charles Bonnet reported one of the earliest recorded cases of Cotard's delusion. An elderly woman was preparing a meal when she felt a draft and then became paralyzed on one side of her body. When failing movement and the ability to speak came back to her, she told her daughters to dress her in a shroud and place her in a coffin. For days, she continued to demand that her daughters' friends and maid treat her like she was dead. They finally gave in, putting her in a shroud
and in a coffin,
laying her out so they could mourn her. Even at the quote-unquote wake, the lady continued to fuss with her shroud and complain about the color.
This color makes me look dead.
Yeah. And then she finally relaxes, falls asleep, whatever. Her family undresses her, puts her to bed. And after she was treated with powder of precious stones and opium, her delusions went away.
Well, opium will cure anything.
They did return a couple months later. 100 years after that...
18-something.
Yeah. A French neurologist, Jules Cotard...
Hence the name.
Saw a patient with an unusual complaint. Mademoiselle X, as Cotard called her, claimed to have no brain, no nerves, no chest, no stomach, and no intestines. Despite this, she also believed she was eternal and would live forever. Since she was immortal and didn't have any innards anyway, she didn't see the need to eat and soon died of starvation.
Oh, good.
Cotard's description of this woman's condition spread widely and was very influential, and the disorder was eventually named after him.
So don't they hear the sounds your stomach makes and don't they feel hungry?
I don't.
Like if I think I'm dead, I'm going to be living on cheesecake and
I know.
burgers. You know what I
'Cause
mean?
what
Like
does it
I
matter?
will be having 3 meals a day at McDonald's.
Mm-hmm.
Who cares at that point?
I know.
I'm dead.
I'm sure they just, that's like my
Yeah.
ribs rotting away or something. In 2008, New York psychiatrist reported a 53-year-old patient, Ms. Lee, who complained that she was dead and smelled like rotting flesh. She
That's
asked
pretty.
her family to take her to a morgue so that she could be with other dead people. They dialed 911
I don't
instead.
mean to laugh. It's mental
I
illness,
know,
but
it's sad, but it's just
funny
so
when somebody's
odd.
like, "Could you take me to the morgue, please?
Yeah.
I want to be with my friends."
Miss Lee was admitted to the psychiatric unit where she accused paramedics of trying to burn her house down. After a month or so of a drug regimen, she was released with great improvement in her symptoms. So you can't, once you get help, you can
get better.
get better.
You stop hanging in the morgue.
Yeah. In 1996, a Scottish man who suffered a head injury in a motorcycle accident began to believe he had died from complications during his recovery. Not long after he completely recovered, he and his mother moved from Edinburgh to South Africa. The heat, he explained to his doctors, confirmed his belief because only hell could be so hot.
Clearly, he's never been to New Orleans in June.
I thought that was hysterical. It's like, see? I'm in hell.
I'm in hell. I am burning alive here in South Africa.
In 2012,
Oh my
Japanese
God, that's
doctors
hysterical.
described a 69-year-old patient who declared to one of the doctors, "I guess I'm dead. I'd like to ask for your opinion." When the doctor asked him whether a dead man could speak, the patient recognized that his condition defied logic, but could not shake his conviction that he was deceased. After a year, his delusion passed, but he insisted on the truth of what happened during it. "Now I am alive, but I was once dead." He also believed that Kim Jong-il was also a patient at the same hospital. Which, I mean, that could be
Could
true.
have happened.
Could be true.
But was there electricity there? Because I think North Korea has no electricity. I love when they like quantify with, but he also believed he was in hell because he was in South.
In 2009, Belgian psychiatrists reported the case of an 88-year-old man who came to the hospital with symptoms of depression. The man explained that he was dead and was concerned and anxious that no one had buried him yet.
I'm
His delusions
rotting.
subsided
Hello.
after treatment. I love that the poor people, like, I'm really worried. Like, I should be buried. Why
Yeah,
aren't
I need to be in the morgue.
Yeah.
My friends are all there.
Yeah. These same Belgian doctors also treated a 46-year-old woman who claimed to have not eaten nor gone to the bathroom in months, nor slept in years.
How did she not go to the bathroom?
I mean, I don't
You
understand
can't
the
control
bathroom
that.
or the eating, but the sleeping, I totally hear her.
but
I have
you
not
can't
slept in years.
control. Like,
No.
if you gotta pee, you're gonna pee.
Yeah. She explained that all her organs had rotted, that she had no blood, and that the doctors who monitored her heart or took her blood pressure were deceiving her because her heart didn't beat. After multiple admissions to the hospital and a lapse in taking her medication over the next 10 months, her condition did gradually improve. Greek psychiatrists received a patient in 2003 who believed he was literally empty-headed.
I know a lot of people like that.
They don't believe it, though.
I know they're out.
Yeah.
You clearly have no brain.
He had attempted suicide years earlier because he thought it wasn't worth living since he didn't have a brain. He was not treated
If
after
I
the
only
incident
had a
and simply
brain.
returned to work. Like, they were like, yeah, go, you're fine.
You're
like,
good.
I mean,
Okay.
Yeah.
All right.
once at the hospital, he claimed that he was born without a mind, meaning that his head was empty without a brain, and for this reason, he is retarded. That is a quote. I'm
Yes.
not. He left against medical advice after several days and was readmitted the next year. This time, he completed treatment and showed sustained improvement in a follow-up interview months later. So once he stuck with the treatment,
Well, it's hard. These psych patients have a hard time sticking with their treatment.
because it's, you know,
It makes them feel shitty.
you're already,
and
it makes you feel crappy. It makes you feel like you're not alive.
Yeah.
And then they're also paranoid. So like,
Right.
this med is doing this
Yeah.
to me, you know, so
They're
they
trying to
stopped
grow my
taking them.
brain.
Yeah. These Greek doctors also treated a 72-year-old woman who went to the ER claiming all of her organs had melted, only skin had remained, and that she was practically dead. She was admitted to the hospital, and her outcome was not reported.
No. Okay.
And then in 2005, Iranian doctors described what may be the most unusual case recorded.
Uh-oh.
A 32-year-old man arrived at the hospital saying that not only was he dead, but that he had been turned into a dog. He said that his wife had suffered the same fate. His 3 daughters, he believed, had also died and had turned into sheep.
Oh.
He said that his relatives had tried to poison him, but that nothing could hurt him because God protected him even in death.
And he's a dog.
Yes. He was diagnosed with Cotard's and treated with ECT therapy and relieved of all his major symptoms. So this guy was definitely out,
Oh, he was out
you
there.
know, and the ECT relieved
Snap
all
them
the
back.
symptoms. So thank God for treatment.
Wow.
Get help. If you have any of those thoughts,
If
like,
you
I
think-
might be dead, go get help. They can treat you.
If you think the morgue is the happening place,
Yeah, you don't want to hang out with other
get a
dead
little
people.
shock therapy.
Yeah.
Wow.
Get some help.
My favorite is
I
I
know.
have to be in hell. That is my all-time favorite.
See?
Yeah, I'm in.
See?
Clearly, I'm burning to death here. in
No one
South
else
Africa.
feels this heat?
I'm sorry. That's the best. All right. Are you gonna?
Do you want me to do Jerusalem?
I think because
Okay.
mine kind of all goes together.
All right.
So all right. So Jerusalem disease.
So then I did Jerusalem syndrome. This is not a technical medical diagnosis.
Okay.
It is a
Syndrome.
It's a syndrome. It's like a no, I'll get into it, but it's
Okay.
not like if you looked it up in the diagnosis
It's
book,
not gonna
it
be
won't
there.
be in there, but it is a phenomenon that happens. And I got this from I got that article with all those people's stories. Where the hell did I get that from? I have it right in front of me. I got it from an article on Health Online by Matt Soniak from 2003.
I like that his name rhymes. Matt Zodiac.
I'm probably saying it wrong.
That's right.
And I got the Jerusalem syndrome information from howstuffworks.com and Wikipedia. Jerusalem, if people don't know, Jerusalem's a tourist magnet, especially for Christians, Jews, and Muslims on pilgrimage to the Holy Land.
Mhm.
So Jerusalem is
The hub.
the Holy Land.
It is the place.
Yeah. Christians go to see the Church of the Holy Sepulchre,
I know what you mean.
where Jesus was crucified and buried, in the Via Dolorosa, which is the path Jesus walked while carrying the cross. So devout Christians go to
Mhm.
see, where he died, where he
Walk
walked.
the path. Usually
They
right,
go, it's the homeland.
right
their
about Holy
land.
Week they start too, and
Yeah.
they recreate it and blah blah blah.
Jewish people go. Jewish people feel the whole city is holy,
Mhm.
but especially the Western Wall.
The Wailing Wall.
Yep. Which is the only thing that remains of the great temple that was destroyed by the Romans. So you'll see pictures of like politicians and whatever at the Wailing Wall or the Western
Putting little
Wall.
notes in the wall.
Yep, and they put little notes and everybody puts their hand on it. That's where Jewish people go to, I don't know, acknowledge the Holy Land. Muslims go to the Dome of the Rock, which is a shrine that is the third holiest place in the Islam faith.
Wow.
So Jerusalem's full of it.
Yeah.
Jerusalem is just full of
Every religious
religion pretty much
extremist
possible.
is probably
Yeah.
there.
So with all this holiness, a lot of people become overwhelmed,
Mhm.
right? Because you've been brought up in
Emotionally
any of these
overcome.
religions that you're told this is what happened, this is what's important, this you're brought up on this, and then you go there and you're like, oh my god, this is where this it's overwhelming. But some experience a rare psychosis called Jerusalem syndrome. It is a group of mental phenomena that involves the presence of religiously themed obsessive ideas, delusions, or other psychotic experiences that are triggered by a trip to Jerusalem.
All right.
80% of people who suffer from Jerusalem syndrome have a history of mental illness.
Oh.
Some doctors say the other 20% have no history, but some dispute that. Like, they'll go and these people have this, I'll get into it, and they experience this Jerusalem syndrome and say they have no history of any mental disorder, like blah, 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 blah. And then some people are like, they were probably on
They
the
just
edge.
never went to the doctor.
They were probably here for this pilgrimage because they are so obsessive.
Right.
A lot of people who take holy pilgrimages are already obsessed,
They're fanatical.
fanatical about religion, which can, comes up a lot
That's
from
the stigmata. I
mental-
mean, you hear people who've gone to Medjugorje, they all come back with these stories
Yes.
of, my rosary beads turned to gold.
Right.
And,
So Jerusalem syndrome has been recorded as far back as the Middle Ages.
wow.
There are 3 types. Type 1, a person has a known history of psychotic illness and travels to Jerusalem because of this illness, thinking that they have
It'll
a
be
mission
cured.
to be completed. So they feel like their mental illness is driving them. I have to complete this religious mission.
Right.
Type 2, it's not really an illness, more of a cultural obsession with the significance of Jerusalem by a person or group. So you don't have a mental illness leading you to go to Jerusalem, but it's like you were raised in, I don't want to say, I'm going to say the word cult. It's not but you're raised with such
Fanatical.
fanatical
I mean, I would love to go to
beliefs.
Jerusalem. I don't
Right.
find myself fanatical. I
No.
would like to go, but
But this type 2, they don't have a mental illness. They're just really fanatical.
Yeah.
They have a cultural obsession. And type 3 are people that were previously mentally balanced, and they become psychotic only after arriving in Jerusalem.
I could see that.
Mm-hmm.
They're overwhelmed.
They're overwhelmed. So patients who develop Jerusalem syndrome are sent to Kfar Shal Health Center.
In Jerusalem.
Well, because this only happens while you're in Jerusalem.
Right.
So over 13 years.
So just get them out of Jerusalem.
Well, that's the cure. 1980 to 1993, 1,200 tourists were seen for this.
Wow.
Yep.
This is like a phenomenon.
Yeah. 470 were admitted. Like, had to stay at the hospital. About 100 people are brought there yearly. 40 of them require admission.
Wow.
Yep. The symptoms are...
Oh, I can't wait for the
anxiety,
symptoms.
Urge to leave the group and wander around Jerusalem alone. So if you're on a tourist group and there's one guy that's like, I'm going to go and walk, and he wants to leave the group, you got to stop watching them. Obsession.
I would want to do that. I would want to see it for myself and not go to the usual spots. Like,
Well, I know, but they kind of, okay. So
I wouldn't in that area because it's not necessarily the hotbed of stability.
And you don't know where you are.
Yeah,
but
I know. I gotcha.
Obsession with cleansing. They baths, showers, they're grooming. It's like a baptismal thing. Like, you're obsessed with grooming and being clean. They don a white gown made from bed sheets. This is literally the symptoms.
Like,
so if a guy on your tour,
are we wearing it like Charlie Brown with holes in it, or are we toga-ing?
No, it's like an old Roman.
We're wearing like a toga,
like Jesus
around Jerusalem.
Yes. So they're wearing the bed sheet as dress.
Could you imagine if we went and I showed up in a bed sheet?
No, I'd be like, get her to the
Admit her.
No.
Admit it. Laura, what do you think of my sheets?
Do I look okay on this?
Are my boobs covered?
Singing or shouting verses from the Bible or religious songs.
I'd be fucked because I couldn't tell you one verse from the Bible.
Marching to a holy place. They're not just walking there to see it. They're
marching
to the holy place. Delivering a sermon in that holy place. So they'll just get up in their bed sheet and start preaching.
I wouldn't even know what to say.
No. Tour guides actually watch for those first two symptoms, people that are showing extreme anxiety and the urge to leave the group. Because they literally are trained. Like, if there's someone that starts wandering, you need to keep an eye on them. If they got a bed sheet on, they send them. But if you're like...
If we progress to bed sheets, yes, they get admitted.
Gone. But if, like, the tour guides actually have to watch for those.
This is crazy.
Mm-hmm. Jewish people tend to identify with the Old Testament figures because that's what they...
Well, now my name is Ben-Hur. It is no longer John.
Right. Christians identify with the New Testament figures. Men with male figures, women with women figures. It's not like they're, like Mike would go and be like, I'm Mary. Like it's like Mike's he would take on like, I'm John the Baptist Jesus, or, whatever. The majority of people who get the syndrome are from North America or less frequently Western Europe, Protestant.
First word, Protestants.
In their 20s or 30s, unmarried. Most have had very, very religious childhoods.
Do they have a lot of cats?
And then most have had, like, they grew up in very strict religious homes and then broke with their religion in adolescence, early adulthood. And now they're trying to repair it.
Yeah.
And they think it's the people from North America and Western Europe because religion doesn't really have a place here
anymore.
Like you're raised in, if you're raised in a very religious family or area, it does, but in our general lives, religion doesn't play a role here. It's not people that come from Israel or
who have
where religion is literally part of your everyday, like, right. So it's more accepted there than it is here. So it's just plays out differently. Treatment for it. Don't invalidate the person's belief that they are a biblical or religious figure. Mild antipsychotics or tranquilizers. Get them out of Jerusalem and back with their families. It usually stops once they leave the city. They leave the city and they're fine. They go back with their family. Like if they're wandering around a tour group and whatever, and then you reunite them with their family, they're like, oh, okay, I'm not John the Baptist or whatever.
I am no longer Mary Magdalene.
Yeah. So some cases, ready? Mm-hmm. A woman who thinks she is the Virgin Mary walks to the Church of the Holy Sepulchre. I can't say that word. Sobs for her dead son Jesus at the altar of Golgotha. Another Virgin Mary invited bystanders to her son Jesus' birthday party in Bethlehem.
We're having cake and ice cream, and we're going to do pin the tail on the donkey.
Yep. There are also many John the Baptists who walk around in animal skins trying to baptize people. Like, this is just a
I don't even know what I'd do if somebody
No.
walked up with a bear skin on and was like,
No.
hey, here you go.
But this case was, I thought this was the best one. An American middle-aged man came to believe that he was Samson, who is a biblical figure with superhuman strength.
I was like, isn't he fake?
He's a figure in the Bible. I think it's
I
Old
know, but
Testament, right?
like, not real.
But he has this superhuman strength, right? So he decided, this man, that part of the Western Wall, or the Wailing Wall, needed to be moved. He spent time bodybuilding at home in America, and then went to Jerusalem.
So
to
he
move
thinks
it.
he's Samson before he goes to Jerusalem.
Yes. Yeah. Guards stopped him and brought him to the Kafar Shaul Hospital. One of the staff at the hospital unwisely told him he was not Samson.
Oh.
So he broke through a window and escaped. A nurse finds him at a bus stop.
Well, he was the only one wearing an animal skin.
Right. No, he's not John the Baptist. He's
Well, I mean, I'm
Samson.
pretty sure Samson, maybe he was in a bedsheet.
a nurse finds him, and she sits down. She's like, "Oh my goodness, only Samson would have the strength to break through that window. Like,
Yeah.
what a great! You're so strong, Samson." And
Come on
like,
back.
really,
I need some stretchers moved.
yeah, let him believe that he was Samson, and got him to come back and cooperate.
Smart
and then
woman.
he was treated, and he was fine. But yeah, he thought he was Samson, so he broke out the window.
Wow.
And that is Jerusalem syndrome.
That's...
So
You've
if
come
you
up with some
go
good ones today.
and you start feeling like you might be a biblical character, or you want to preach somewhere,
Yeah.
maybe just leave the city for a little bit.
Yeah, go
Go
take
to
a breather.
another city.
Go chill out in
over
Egypt
there.
for a while,
Yeah,
you know.
Take a little break. You'll be better. You just have to leave the area.
Now, I should know this. Is Jerusalem in Israel
I think Jerusalem's its own.
country? Or is it its own...
Isn't Jerusalem its own?
Where the hell is Jerusalem? I know it's Middle East. I just don't know where in the Middle East.
Hold, please. Now you're
I'm
asking.
just curious. Like,
I
you
thought...
don't want to be wandering around those areas alone. Especially if you're an American.
Yes, it's the capital of Israel.
Oh, it is? Okay.
Yeah.
I know that I sound really stupid saying that.
No, I was like, I thought it was its own thing.
Yeah, I'm kind of a dumbass. All right. Well,
Mhm.
since we're on the Jerusalem issue here, I am going to continue with those lovely Romans and the things they love to do to people that they didn't disagree with.
Oh, this is going to get rough.
With the ultimate torture, the ultimate punishment of crucifixion, and how you actually die from crucifixion.
Mhm.
I had to tone it down because
Yeah.
it was rough.
Mhm.
It was rough. So, as we know, the Romans basically ruled the world back in the day, and they needed to maintain control. So they had a lot of laws.
Mhm.
They had a lot of slaves.
Mhm.
And if you broke their laws, they were going to punish you to keep everybody in line. Because if you lose control of one territory, they're all going to follow.
Mhm.
There were different types of punishments for different types of Romans. So if
Okay.
you're a regular run-of-the-mill Roman citizen, they had fines, bonds, stripes. I don't know really what they did at stripes.
Okay.
I can't even... Infamy, banishment, slavery, and death.
Nice.
A Roman citizen, if they were guilty of treason, they could be sentenced to death. Types of death.
Mm-hmm.
For treason, you could be stripped naked. They would hold your head up with a fork and whip the shit out of you until you died. They would behead you. They could strangle you in public. They could throw you in the dungeon.
Strangling takes a long time.
Yeah, well, we're going to do it in front of everybody. And these were public events.
Yes.
They like to
Oh,
make
everybody
them-
went to watch.
Everybody liked this. They could throw you in a dungeon. They could throw you from a rock, or they could throw you into a river. It only gets better. Now, political criminals, they start introducing animals. They think it's really good. Let's get wild animals involved in this.
Really making a show.
Yeah.
Yeah.
In 167 BC, army deserters were crushed to death by a horde of elephants.
Oh my god!
And it's so popular, death by animal, that they start doing this in the Colosseum daily. And hundreds and thousands of people go to the Colosseum every
To
day
watch
to see
people die.
somebody mauled by a lion, eaten by a tiger, whatever. I feel bad for the poor goddamn animals, to be honest with you. If you killed your father, you were thrown in a leather bag with snakes. And then you could either be thrown to the beasts if there was no river around. But if there was a river around, you and the snakes went in the water. Slaves got it different because they were worth money. So if you were a slave, you got whipped. Some were branded on the forehead. Boom,
Oh my
dumbass,
God.
right there on your forehead. Some were suspended with a weight tied to their neck, and they had to walk around with this weight on their neck. Yeah. You might have a carry a piece of wood around your neck, too, as well. You could be confined to a workhouse, which consisted of you were strapped to a stick, kind of. Like, so you're on a wheel. You know, you'd use animals now, and you spun the wheel all day long to crush corn. So you were like Sisyphus in a rock.
God.
The worst of all the Romans' punishments was the crucifixion.
It's not pretty.
It is said that crucifixion is the worst form of punishments humans have ever come up with.
Wow.
I will go over all the information. But Professor Alan D. Callahan told PBS, the Romans had a genius for brutality. They were good at building bridges, and they were good at killing people.
Wow.
And they were better at it than anybody else in the world, or in the Mediterranean basin, that they had ever seen before. So Romans perfected fucking people up.
Torture.
Crucifixion was considered such a humiliating form of punishment that if you were a Roman citizen, you would never be crucified.
Oh.
No matter what the offense. It was a form of public terrorism to keep people in line.
Right.
I mean, they did say at one point there was some battle between the Greeks and the Romans or whatever, and all of the soldiers that were taken, like 300 of them, were crucified on a road and just stuck along the road. But it's never been substantiated, so I just threw that, do that in passing. So crucifixion is more than you just get nailed to a cross. It starts with a good old-fashioned flogging.
Yes.
Okay, so the prisoners were strapped and tied to a block of wood. The executioner would whip them with a 9-tailed whip. The tips of the whip would either have metal or bone clippings on the tip. Now, you are stripped naked, and they're whipping you. And the tips were designed to whip the skin and muscle off of you. And they would make sure that they reached over to your chest when they whipped you, and your face and your head. So you are completely lacerated. And the purpose of this was to mar the victim beyond recognition and to bring you within a brink of death. So they could not whip you to death. The executioner would make sure that they whipped the face and the head, and they would put the victim into immediate shock. So this is what they wanted. They wanted to put you into immediate shock. So now after you are whipped, you are going to carry the wooden beam that you would be affixed to. And it's not like you see in the movies, a nice wood-shorn, pressure-treated beam of wood. It was an old ratty, splinter-filled piece of tree. So they made sure that as you're carrying this, all those splinters in the tree are ripping up what's left of your skin.
God.
And you are walking through town with all of this. All of this now brings on hypovolemic shock because you're bleeding from all of this place. And hypovolemic shock occurs when a person loses 20% more of body's blood supply. Symptoms of hypovolemic shock are nausea, sweating, dizziness, confusion, and loss of consciousness. So you're really fucked up before you even get stuck to the cross. Now, once you get to the place of the crucifixion, you're going to be nailed to this cross. Nails were driven into the wrists, and this would usually pierce the nerves in the wrist. The direct exposure of the nerve to the nail and the rubbing of the metal against the nerve would be a constant recurring pain that would be brutal anytime the crucifixion person... So I'm going to tell you the crucifixion person pulls up to breathe, but we're going to get more into why they're pulling up. So in 1968, a skeleton dating back to Roman times was found, and the skeleton was clearly crucified. His wrists still had the nails in, so it is confirmed that that is how they did it. This guy, they have a picture of it, and in between the ulnar and radius, you can see the nail where he was hung. So some people could have their arms tied, but most of them were nailed to the cross. The feet were anchored with nails or a rope, and you would be on this little tiny block, kind of like you see Christ, his feet are over this little block. So your arms are out, your feet are up. Once you're upright on the cross, you immediately dislocate both your shoulders. So your arms stretch out 6 inches on either side, longer than they normally would be. That is contributing to suffocation. So with the weight of the body pulling down on the diaphragm, you have trouble breathing and getting a good fresh breath, so you're starting to suffocate. Talked about the shoulders being stretched out, and this causes the chest, when you dislocate your shoulders, it causes the chest cavity to protrude outward. So you can breathe in, but you can't breathe out. So you're also building up CO2, etc. So the victim is constantly trying to pull up to get oxygen.
Yeah.
Right. So they're stepping. Every time they start to collapse, they step. So that's rubbing on that nail in their wrist constantly. So now you're getting fatigue and muscle cramps in the legs from trying to do this, and the body is really almost in complete shock. You can't breathe, you're losing O2, you're building up CO2, and you're adding cardiac stress and hyperventilation. The cardiac stress in some people cause their heart to actually rupture in the chest. You're hyperventilating, bringing on fever and anxiety. And the fever, it taxes the already agonized muscles, and it adds to the pain. I mean, so they said when you add the anxiety of the pain of the crucifixion, anxiety to the pain of the crucifixion, it brings on such a central nervous system shock that people today could never know what that experience is. I'm not going to say nobody, because some people, you hear the torture they've been through it, but very few people have ever experienced this kind of psychological, physical torture. So the guy's a bloody mess up on the cross. They're losing consciousness. They're suffocating. But it takes a long time. So the executioner, he's tired. He doesn't want to wait any long for this guy to die. So he'll take a sledgehammer to femur bones and snap their legs so they can no longer push up to fix it. So as if everything else in your life doesn't suck enough, he's just broken both your femur bones.
Just stab you in the chest. Let
Imagine how much it hurts to have both of your femurs broken at the same time. So he takes a nail to the thighs. He breaks your legs. Speed things up. So without the option of pulling yourself up to breathe, you're going to suffocate and die, which is a blessing at the end of the crucifixion. I got that information from 10 excruciating medical facts about the crucifixion of Christ. And punishment in ancient Rome's facts and details.
Lovely.
Yes, it was rough. I thought I wrote more about that, but it was rough. The Romans were not a kind group of people to deal with.
You see it, like you see the pictures of, the cross or whatever, and you're like, I can't even fathom, like, being nailed to, it's just the whole thing's awful, but then you don't think about, like, your shoulders done. Like,
I always wondered, like, how does that kill you? Well, that's how it kills you. You suffocate.
You can't breathe.
The closest depiction I ever saw was the movie The Passion that Mel Gibson did.
Oh, yeah.
I was pregnant with one of my kids when that movie came out. I was like sobbing. Because the mother's standing there. Like, take the whole religious aspect out. Your mother watching her son be flogged to a bloody stump, walking through the streets, and it's hot, it's dirty, you're bleeding to death, and then having him nailed to the cross and watching them do that to him. Like, I just can't even fathom. So, we're going to end this on a happy note.
Okay.
We got a lovely email. And I have to say to Molly, when your email came in, Laura and I were sitting together at work, and Mike sent in the email, and we're both separately reading it, and we're both cracking up because I thought this email was wicked fucking funny. Okay. So, Molly writes, Dear the wonderful ladies from the Scissors and Scrubs podcast. I mean, I already love her because she thinks we're wonderful. Okay. I want to preface this story by saying I grew up, caps, terrified of doctors. When I was 9 months ago, or 9 months old, I'm not really sure what she meant, I had emergency surgery on my heart. I wasn't given the right amount of anesthesia, and I woke up during the procedure, and even though I don't remember it, I've had an irrational fear of doctors ever since. Pretty funny how I ended up being a pre-med student and pharmacy tech at 20, but that's another story. Due to my fear of doctors and being a sickly child, I hated any trip to the doctor's office, even if it was just a checkup. I would cry and scream as a child and do anything I could to get out of an appointment. My ideas were typically hiding somewhere in my house or, in my very stupid child mind, pretending to be sick so I didn't have to go. I was a bright kid. When I was 15 years old, my brother noticed a lump on my chin. Like every brother notices. They scan you just to fuck with your face. Naturally, as all brothers do, he started making fun of me and saying I looked fat, because that's what brothers do. They're great. I ignored him, but then everyone was like, damn, she's looking a bit chunky under her chin. Needless to say, I started wearing scarves. Oh, God. Everybody wears scarves to cover shit up. I'm wearing scarves. However, the lump was hard and growing fast, so eventually I had to go to the doctors to get it checked out or move up to cowl necks.
Right, I mean, you can keep going.
Of course, I'm trying not to panic, and then they're like, well, maybe it's a tumor. Why would you say that?
No, you don't.
Why would you say that?
We're just going to take that out.
Oh, thanks, Doc. A tumor and a crippling fear of doctors, just what I wanted this Christmas. My GP, knowing my fear of doctors, prescribed me a Xanax for my upcoming MRI. I took half a pill and went on my way to my MRI. I was really skinny at the time, and I'm only 5 feet, so that pill hit me faster than a train. I felt like I shouldn't have been scared, but I wasn't. I felt like I should have been. No, she wrote shouldn't, but I think it meant should have been scared, but I wasn't. I was kind of just there. I was dozing off while my mom cried. And the doctor of the prospect of me dying of cancer at 15 while my high ass was thinking about what I wanted for dinner. That would be me.
Yeah.
Can we go to McDonald's?
This sounds all very familiar.
MRI went as well as it could have. And I started. Give me a second because I got to find the second heart. And I started home. When I got home was when shit hit the fan. I went to the restroom, as one does, in my pants and undergarments was I went to the bathroom, as one does, and in my pants and undergarments was a lot of blood.
No.
I immediately thought, this is all coming out of my butt. My organs... Because that's a normal train of thought. My organs were failing, and this was the end. I have a tumor on my... There you go. I have a tumor on my chin. I'm dying and rotting, so now we're all dead. Now, I was coming off the Xanax at that point, and you would have thought I drank 6 beers the way I was acting. So, of course, I'm crying and screaming. Why you would ask for your brother? If I'm bleeding up my ass. Why didn't you ask your mom? Like, your brother, really? No. So, of course, I'm crying and screaming for my brother downstairs and telling him I'm bleeding out and I'm going to die. He starts freaking the fuck out and calling my mom, who was already thinking you're dying of cancer. My mom runs upstairs and takes one look at me and says, you started your period, you idiot. You aren't bleeding out of your asshole. I'm dying. I'm dying out of my asshole. Believe it or not, I was so out of it, I needed a little convincing. How do you convince somebody that's period blood, not your asshole blood?
No, really look at it.
Put a tampon in, I guarantee you it stops. Don't smell it.
Wipe in the front.
What if she had hemorrhoids at the same time, though? Because then you wipe your ass, it's going to be bloody. Yeah. All right. But after I was sure I wasn't on the brink of death, parentheses, not due to GI bleeding at least, I decided that was my first and only time I'd take a Xanax. I think that's a good idea, Mom.
You might want to stay on those.
I hope I'm not too illiterate that you all couldn't find something to enjoy from the story. Oh, I enjoyed the story. Yeah. And I love watching your podcast and can't wait for another year of Scissors and Scrubs. Well, let's hope we can keep it going. Yep. I was dying of bleeding out your asshole.
I'm bleeding out my ass.
My brother would be like, you're a fucking moron.
That's disgusting. I don't know about your ass and you bleeding.
You're gonna die. I got your room. Oh, so that is our joyful Easter episode. Yeah. Go get your Cadbury creamed eggs, my all-time favorite Easter candy. Mm-hmm. Or your Cadbury mini eggs, because I love those too. I love me some mini eggs. Mm-hmm.
I just got... See all this pink shit on the floor? Because Sam keeps stealing it. I just got edible Easter basket grass.
Where'd you get? What is it, like gum?
I don't know. It's like weird styrofoam, but it tastes like strawberry, and you can eat it.
That doesn't sound good for you on any level.
Of Sam, he's like, "What are you doing? What are you doing? Why are you eating that? What are you doing?" He's like, "Wait, is that edible? Wait a minute, what are you doing?" And I'm like, "I don't know. I just thought I'd try it." And he's like, "You can't eat. It's plastic. Isn't it plastic? Is it plastic? Can you eat that? What are you doing?" And then he starts eating it. He's like, "Wait, it tastes like strawberry. Wait a minute, can I eat this? Is this okay?"
Where did you find it?
Michael's.
Edible Easter grass.
Yeah, so I gotta go get some of that. Like the little chocolate eggs in.
Oh, I'm getting that. Because most of the time I have picking out fucking Easter grass out of their bedrooms in July.
Forever. Yeah. Well, as you can see,
it's now down the basement, but at least you can eat it.
At least
it will biodegrade at some point. So happy Easter, happy Passover, happy whatever else you celebrate.
Yes.
And
happy spring. Just happy spring. Yeah.
We're gonna cover marathon running and the shit that happens at marathons.
Oh, the shit that happens.
Yep. All right. See you later.
Bye.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.